I'm one of the RNs, and I'll be doing a full assessment on you today. You agreed to allow me to do an assessment on you?
Yes,
What's your name?
Kevin Jackson.
Mr. Jackson, it's good to meet you. I'm going to go ahead and wash my hands with my hand sanitizer. I'm going to, I had you earlier fill out a health history, and we'll get to that at the end. I wanted to go ahead and note your vital signs that we took earlier. Your heart rate was 82, regular. Your blood pressure was 134/88. Respiration rate was 20, non-labored and regular. Your temperature was 98.9. Your height is 69 inches, which is 5 feet 9 inches. Your weight was 83.45 kilograms, and you scored a 28 on the mini mental assessment. Can you tell me what today's date is?
22nd, November
22nd of November. What year, sir?
2014.
And who's the president?
Obama.
That shows, I asked you those questions to see if you would, to try and get a Glasgow Coma scale to see your level of consciousness. When I walked in, you automatically looked at me, spontaneous eye opening, which would have been a 4 on the Glasgow Coma. You obeyed commands by answering my questions, which is a 6 on the Glasgow Coma, and you're oriented ×3 because you know the date, the year, who you are, and the situation. I'm going to ask you now, so that made a total of 15, which is the highest and normal for a Glasgow Coma. I'm going to ask you to stand, and we're going to go ahead and do the visual acuity exam. Okay. I know that you have corrected vision and you use glasses. You can go ahead and put them on. And we're going to ask you to read the lowest line that you can, covering one eye up.
FDPLTCEO.
Correct. And I need you to cover the other eye up and read the lowest line that you can read.
FDPLTCEO.
Thank you. That was correct, and with your corrected vision, you have 20/20. I'm also going to, while you're standing, I'm going to go ahead and do a visual of your spinal. Make sure there's no abnormalities. What I need you to do is bend forward and reach for your toes. Good. Your spine is aligned. There seems to be no scoliosis, no extra curves, no kyphodosis. You can stand up, sir. Come back and have a seat, and I'll have you do the near vision test. And I need you to keep the card this far away, and you read the lowest line that you can. Huh?
Glasses on.
Keep your glasses. Well, your glasses don't matter for your nearsighted. You can take them off if you need to. And read the lowest line.
LOPFZEDCT.
Oh my, you have more than 20 vision. You actually have 20/10 with the glasses off. Do you want to, I'm going to ask you to cover one eye and do the same thing, and then do it with the other eye.
EZEDCT.
Correct. Now the other eye.
DZECLPTOF.
Oh, so you have 20/20 in that eye, and then you have 20/10 in the other. Thank you, sir. Now, we did the Snellen eye chart to check your optic nerves, and I'm going to go ahead and use the pen light to further check your cranial nerves, okay? Optic nerve is nerve number 2. I'm going to sit this down beside you. All right, so I'm going to shine a light in your eye, and I need you to follow my directions. I need you to look straight forward at me, and then there's going to be a bright light in your eye. Your eyes, pupils are about a size 3. They're brown reactive and reactive to light. They're equal. And now let's check for accommodation. Good, you followed it, and you have have accommodation. And that was checking your cranial nerves number 3, 4, and 6. No, it was not. This will be checking cranial nerve 3, 4, and 6. I need you to follow the pin light. Thank you, sir. You did all of that correctly. I'm going to put my pen light down for a little while. 3, 4, and 6 are oculomotor, trochlear, and abducen. And now I'm going to go ahead and look at your head, assess your head by palpating it. You have no bruises, bumps. I don't see any lesions. Your hair is clean. There's no dryness or any sort of thing. You do have a receding, almost a balding pattern, but you told me inside your history that that's a familial, a hereditary trait. Other than that, I didn't see any kind of abnormalities. Your top of your ears line up with your eyes. Your nose, your eyes and your mouth and your nose, everything is symmetrical. So they're bilaterally equal. I need you to smile. Yes, that's bilaterally equal also. Can you raise your eyebrows for me? Can you puff out your cheeks? Correct. That's so I could check your accessory nerve. No, that's not the accessory nerves. That's your facial nerves. I believe those are nerve number 5. All right, next we're going to go ahead and do range of motion for your neck. I need you to put your ear as close to your shoulder without moving your shoulder, the other side without moving your shoulder. Raise your shoulders, push against my hand, push against my hand. I need the pen light again. I'm going to look in your mouth. I'm using the tongue blade. Open your mouth, stick your tongue out for me. Say ah.
Ah.
Your uvula is midline. It stayed midline even when you said ah. There was no lesions or abrasions or anything in your mouth. Your dentation was normal, and I appreciate that. I'm going to go ahead and press on your sinuses. Tell me if any of this hurts. Good job. While I'm here, I'm going to check your lymph nodes. There's some in the front of your ear, around back, to the back of your skull, back of your head, up under your jaw, down your neck, above and around your clavicle. And I didn't feel any kind of nodes or nodules, so you have no lymphoadenopathy, which means all of your lymph nodes are normal, and I didn't feel any kind of any kind of nodules or hard places. There was nothing there, which is a normal finding. Your sinuses, there cannot be any fluid or anything in there, or it would have been tender, or it would have hurt when I applied pressure. So that's a good thing. I'm going to go ahead and check your arteries in your temple. And they're right here. They're 3s. I'm going to listen to them, and so I'm going to listen with the bell side because I can hear sounds like bruits and lifts, thrills or heaves better with the bell side than I can with the diaphragm side. So I'm going to listen with the bell side. Then I'm going to listen with the diaphragm side. didn't hear any abnormalities there. I'm going to check your carotid artery. I can only check one at a time because I don't want to cut off the blood flow to your brain. I don't want you passing out. Carotid arteries are about a 3. I'm going to go ahead and listen to them. Begin with the bell side, pouring Bruix. I'm going to palpate your thyroid. While I'm doing that, I note that your trachea is midline. There's no JVD, that means jugular vein distension, which we would see if your heart is having to work real hard, if your blood pressure is high. I didn't feel any abnormalities. Your thyroid does not seem to be enlarged. I'm going to go ahead and listen for bruise with the bell side at your thyroid. All right, I'm going to have you swallow a little bit of that water. Good job. Still no abnormalities with your swallowing or with your thyroid while you were swallowing. And I'm going to listen while you swallow now. Good job. Good job. All right, I appreciate that. So we did your vital signs. We checked your optic nerve with the Snellen chart. Let's go ahead and check, close your eyes. Check your olfactory nerve, and I'm going to do that by checking your sense of smell. I need you to cover one nair and tell me what you smell. Nothing. Hold up.
Oh, snap.
Yeah, I had to rub it in, looks like it. Now, I need you to cover the other nair. And I need you to tell me what you smell.
Alcohol.
Good job. That's my hand sanitizer. I was going ahead and washing my hands again. That checked your olfactory nerve. Now I'm going to go ahead, which is nerve number 1. Now I'm going to go ahead and check your trigeminal nerve. I'm going to do that by performing a test with a sharp object and a soft object. When I touch you on your face with your eyes closed, I want you to tell me whether I'm touching you first off, and then I want you to tell me whether it's a sharp or soft touch, okay?
Sharp. 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 Soft. 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 Sharp. 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 Soft. Soft. Sharp. 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 Soft. 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 Sharp.
All right. That was good. That was to check one of your cranial nerves. That's the trigeminal nerve, which is cranial nerve number 5. So we've done cranial nerve number 1, which was the smelling, cranial nerve number 2, which was the eye charts, cranial nerve number 3, 4, and 6, which were the following my pen light, and that checked for your oculomotor. It also checked for your trochlear, and it checked your abducen, which was, like I said, 3, 4, and 6. We just checked cranial nerve number 5. We checked cranial nerve 7, which was the facial nerve, and that was when you were smiling and you puffed your cheeks and you raised your eyebrows for me. And then we checked cranial nerve number, no, we haven't checked cranial nerve number 8. That's your vestibular nerve. Usually we would check it using like the Weber test or something, but we can't do that, so I'm going to do a whisper test. What I'm going to do is whisper in one ear, and you'll tell me what I'm saying, and then I'll whisper in the other ear, and you can repeat back what I'm saying. You understand?
Yep. 1, 2, 3. Nobody knows.
And that is exactly what I was saying in both ears. So that means your cervical nerve number 8 is intact and there's no abnormalities there. I checked your glossopharyngeal and your vagus nerves whenever I looked in your mouth, and your uvula stayed midline. So those nerves are also normal. And I also checked your no, we haven't checked the last nerve would be your hypoglossal nerve. And that would be checking with your tongue. I need you to stick your tongue out. Move left to right. Good job. Now close it and stick it against my finger. Good job. I'd say your muscle strengths are about a 5, so that's normal. And that nerve is intact and you're having no problems with any of your cranial nerves. I'm also going to check for stereogenesis. And to do that, I need you to close your eyes. Open your hand. Tell me what I put in your palm.
Money. Quarter.
Hey, that's a good. Now, tell me what I put in your palm.
Paperclip.
Tell me what I put in this palm.
Another quarter.
And tell me what I put in this palm now.
Paperclip, same one.
Exactly. So those sensations are intact. Now, I'm going to write in your hand, and you can tell me what letter I'm writing.
With an F.
Now, what letter am I writing?
A V.
We're going to do it again. What letter am I writing?
A G. Do it again. A G. That's a funny G.
What letter am I writing? Actually, we're going to do a number this time.
One more time. A 3.
Yeah. Now, what number am I writing?
One more time. A 0.
Correct. So you'll notice that you got those correctly, and that's called graphnosis. It's to make sure that you have correct sensation. I'm going to use this now to check 2 points, which is point localization going to first do it on your fingers. Tell me, am I touching 1 point or 2?
2. 2. 1. 1. 1. 2. 2. 2.
All right, now you're going to tell me on your arm.
2. 2. 1. 1. 2. 1.
And on your face.
2. 1. 2. 1. 1. 2.
All right, so you'll notice that I had to get further apart with the points whenever I did it on your arms. Your hands are more sensitive. You can open your eyes. Your hands are more sensitive, so you can get the points further closer together. And that's both are normal findings. I've already palpated the arteries in your temple and your carotid and listened to it. I already noted the location of your trachea to notice if there was deviation. We checked your accessory muscles when I had you lift your shoulders and turn your head side to side, and at the same time we were checking your range of motion for your neck, which it seems to be normal. Now I'm going to go ahead and state that the findings that I found on your face, there was no draining or redness to your eyes. Everything seems to be normal there. There's no drainage or redness to your ears. No abnormalities. Wait, except for, did you have your ear pierced?
Yes.
Bilaterally, they're equal. No abnormalities to the skin on your face or your head. There were no bumps, bruises, abrasions to your head. Now we're going to go down and go on to your chest. To check your chest, I'm going to check your chest wall expansion. I'm also going to check your breath sounds. I'll check your heart sounds. And I'll use both the bell and the diaphragm side of the stethoscope to check both of those. First, I'm going to inspect your chest. I don't feel any crepitus. Checking your back. There's no crepitus. I need you to take a deep breath. You look like your breathing is deep, regular. I need you to take another deep breath. The expansion is bilaterally equal. I'm going to check that in the back too. Take a deep breath. The expansion is bilaterally equal. Your chest shape is regular for a 46-year-old black male, which we know you are, so that's normal. Now I'm going to listen to your chest sounds. Your breathing sounds come first. I'm checking this with the diaphragm side first. I'm going to first listen to your bronchial. Take a deep breath. In and out of your mouth, a deep breath. Deep breath. Good job. Now the bronchiovestibular. Take a deep breath. Deep breath. And then I'll listen to your vestibular. Deep breath. Deep breath. Thank you, sir. And one more time on this side. Now I'm going to listen in the back. Whenever I listen to the back, I have to make sure that I avoid the scapula because it will get in the way of me hearing your chest, your lung sounds. So take a deep breath. 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 Thank you, sir. Now, while I'm back here, I'm going to go ahead and look for tactile frepidus. By doing that, I want you to say, boy, oh boy. Whenever I put the plony portion of my hand to your chest wall, well, it's not your chest wall, your back. And so, whenever I put my hand to the sections, say, boy, oh boy for me.
Boy, oh boy. Boy, oh boy. Boy, oh boy.
Now we're going to do it in the front. I'm going to use the bony section of my palms this time.
Boy, oh boy. Boy, oh boy. Boy, oh boy.
There is tactile frepidus everywhere. It gets lower. You can't feel it as better the lower down you get. You're supposed to feel it best in the bronchial areas, and that's because sound waves travel through solids harder, so it gets, if there's any sign of consolidation or there's water or anything, the sounds, they'll drop away. The vibrations will drop away. So you're normal there also. Now I'm going to go ahead and listen to your heart sounds. Your breathing. I didn't hear any adventitious breath sounds. They were non-labored and they were bilaterally equal. Now to listen to your heart sounds, I'm going to use the bell side of the curve of the stethoscope because we can hear better whenever we listen for heart murmurs or any kind of abnormalities with the heart. With the heart, I need to listen for S1, S2, which are normal sounds, and we're going to hope that there's no S3 or S4. Okay? All right, to find placement where I listen, I go down to your right side, I go to the second intercostal space. Left side, second intercostal space. Left side, third intercostal space. Left side, fourth intercostal space. Left side, fifth intercostal space, but I move over some and go mid-clavicular. And then I'll also listen with the diaphragm side in all of those spaces too. All right, those were all of your heart sounds. We started with the aortic, which was your first one. The second one was the pulmonic. We're moving over to the heart. Your aortic, your pulmonic was the second sound. Erb's point is the third spot. Your tricuspid is your fourth spot. And that fifth spot is your apical or your mitral valve. And I didn't hear any murmurs, any thrills, any heaves. And I only heard S1 and S2, which is exactly what we were looking for. Now, I'm going to go ahead and I believe we'll do breast exam since we're still on the chest. I'm going to show you first. Are you going to sleep on me?
No.
I need you to raise one hand, put it behind your head, and the correct position to check for any kind of breast abnormalities. You would use your other hand to palpate or feel. Men can also get breast cancer, so it's just as important that men check. It's not as common for men to get breast cancer, but it's still important. I'll check your lymph nodes in your arm, well, in your axillary. And there's no lymphoadenopathy there. Now switch. And I'll do the same thing to this side, to your right side. And check for any kind of abnormalities in your lymph node, and there was no lymphoadenopathy there. And now, if you would please demonstrate that to me, and tell me what exactly you're checking for.
Any abnormalities like bumps, anything I feel different.
Correct. And let me know if you feel anything different, and then you can move to the other breast.
No, nothing that
The reason that we're doing this while keeping your clothes on is to maintain your privacy and your dignity.
Nothing that
Good job, and you did a correct demonstration of your of the breast exam. And I told you, like I said, men can have breast issues also, because you do have mammary glands and you do have breast tissue. Cancer is just not as common. It's actually really low among men. Since we've done your heart sounds on your chest, and we've checked your carotid arteries and your temple, the arteries in your temple also, I'm going to go ahead and check your pulses. They're 3s, bilaterally equal. Also 3s, bilaterally equal. We'll get to your legs later. I'm going to go ahead and try and check it in your knee, your popliteal pulses. That one is a 3, which is a normal. And that one's also a 3, which is a normal. A 2 to 3 is a normal pulse pressure. As long as I can feel it and it's not ready and it's a little hard to obliterate, then that makes it a 3, which is correct for all of the pulses that I have checked. I checked your temple, I checked your carotid, I checked your radial, I checked your brachial, and I checked your popliteal. Later on, we'll check your posterior tibial, and we'll check your pedal pose, or your dorsalis pedis. Now, I would like to check your reflexes. The first one I'm going to check is your brachial reflex. And I do that by putting it on the brachial muscle and then tapping. Not sure if you can see, but there is a jump. There's a jump there too. Check your tricep muscle. Let's see. I'm sorry. next one. And the other arm. And it moved just a little bit. Now I'll check your patellar reflex. Good job. And patellar reflexes are fine also. That was just a reflex test. Now, since we've done your pulmonary, which is your lungs, I listen to the lung sounds in all fields, both in the front, back, and also in your axillary on the side, the lateral. I listen to your heart sounds, all 5 of them, with both the diaphragm and the bell. I check your radial pulse, I check your brachial pulse, I check your carotids, your temple, and your popliteal pulses. Now I'm going to go ahead and listen to your abdomen. All right, while I'm listening to your abdomen, I'm letting you know that I'm going to listen into 4 quadrants. Your upper on both your left and your right, and then your lower on both your left and the right. And then I'll also listen in the middle, right above your navel, to listen to arteries. I'm going to listen for vowel sounds with the diaphragm side, and I'll listen to your arteries with the bell side. I'm going to first listen to vowel sounds. Vowel sounds were normal active, and they were all in every quadrant. Now I'm going to listen to the artery sounds by turning it and switching with the bell. The first one I'm going to listen to is your aortic artery, and that's the above your navel, but it's midline. And I'm listening to see if I hear any bruits, any thrills or heaves, which would mean there was something wrong with your artery walls. And then in the quadrants, the upper quadrants, I'll listen to your renal arteries. That's the arteries that supply blood to your kidneys. And again, I'm listening for any bruits, thrills, or heaves. Excuse me. Now I'm listening in the lower quadrants would be your iliac arteries, and they supply blood to your lower extremities, which is your legs and your feet. So I didn't hear any bruits. There was no thrills or any heaves, so all of that is normal. With your arteries, I'm going to go ahead and do, let's give me your hands again. We're going to check for your capillary refill. Good capillary refill. It was less than 2 seconds, which is brisk. Your nails then are clean, your hands are clean, you're well kept. I'm checking out your skin while I'm here. Your skin is color is appropriate for your race. The texture is normal. Your elasticity is normal. There's no tinting. There's no abnormalities to your skin, any of that that's available. I'm going to ask you now to remove your shoes, and so I can check both your tibial, posterior tibial and your pedal pulses, and check for edema also. In your legs, it could be dependent edema, and that could be a sign of vascular and heart issues. So there's no edema, if you'll see. There's no swelling to either one of your feet. Your toenails are clipped and they're well kept. I'm looking at your leg. The hair on your leg, the distribution is even. So I'm thinking that there's no problem with the circulation to your legs. Distribution is still even on this leg too. We're going to go ahead and check your pedal pulse or your dorsalis pedis. And they are 3s, they're regular. And then at the back, we check for your posterior tibia pulse. That is 3 and regular. And check on the other side. That is 3s and regular. You can put your shoes back on, and then we'll do muscle strength testing, and that'll be the end of the physical assessment. So far, we've covered the systems from your cranial nerves. We covered your integumentary divisional parts. I didn't have you totally undressed because we want to make sure we maintain your privacy and your dignity. And you're doing this assessment as a favor to me anyway.
Yeah, because it costs for that show.
So we checked your cranial nerves from 1, which was your olfactory, you smelled for me. 2 was the eye exam, where we did the Snellen chart and the near visual acuity. 3, 4, and 6 was following my pen light around, which were the ocular motor, your trochlear, and your abducens. 5 was the trigeminal, where I was putting pointy and soft on your face to see about your sensation there. 7 was your facial nerves, where I had you move from side to side, and I was checking your tongue and checking the inside your mouth. 8 was the vestibular nerve, which we couldn't do a Weber's test, so we ended up doing the Whistler test. 9 was the tongue, the glossopharyngeal, and the vagus nerve, so looking in the back of your throat, doing the midline uvula. And then that was 9 and 10. 11 was the accessory muscles with the shoulder shrugging, and the 12 was the tongue. Now, stand up for me. I need you to do a heel-to-toe walk for me. You know how they usually do with sobriety tests? I need you to close your eyes.
Oh, yeah, close your eyes and do it.
Well, nah, you don't have to close your eyes and do that.
Yeah, that's
You
a right,
okay?
not the tiptoe thing. I can see.
The boots must be a little much for you. I know, you're actually doing really well. There's no swaying, and you can do it. Now, to do the sobriety part is close your eyes now. As you can see, there's no swaying. Now, I need you to do your finger to nose testing. Again. The other side, one more time. Good job. While you're standing, we might as well do the muscle strength test. Grab a hold of my hand, squeeze my fingers as tight as you can. Now let go. I need you to pull me towards you. Great job. Push me away. Great job. You can have a seat. We're going to do the rest of your lower extremities. Lift your knee. Great job. Lift this knee. Great job. Kick out. Kick out. Pull. Pull. Push up your toes. Push down on the gas. All your muscle strengths are about a 5, which is normal. When actually, you're a good bit stronger than me, so you're definitely normal with your muscle strengths. And I believe that should end our assessment. I want to tell you thank you for all of the help that you've been to me, and now we're going to talk. Well, we have one more. I need you to rotate your palms as fast as you can. Good, good. That's normal. There's no abnormalities with the palmar rotation, and you did your heel to toe and finger to nose. So I appreciate it. The only abnormalities that we got for you that were actually of notice were the fact that you wear corrective vision on glasses, and otherwise your physical assessment was normal. Your blood pressure at 134/88 is a little on the side of being pre-hypertensive. Your blood pressure is on the way to being pre-hypertensive. The only thing for education-wise that we could end up talking about is your family history of prostate issues. You said that you're a 46-year-old black male. Being African American automatically puts you at a higher risk for prostate issues because that's a non-modifiable risk factor. Your dad dying of prostate issues at 63 also puts you at even a greater risk factor of prostate issues. And then you told me that you had not gotten your prostate exam, even though your risk factors are so high. I know that you don't want to because of certain stereotypes or certain fears of the digital rectal exam, but there's more than that to do for prostate screening. They can do blood, they can do ultrasounds. So it'd be beneficial for you to go ahead and get your prostate checking out. Plus on the health history that you filled out to me, you also noted that you had nocturnal urinary frequency, which is also another sign of prostate issues. This is a sign of benign hypertrophic prostate, which really pushes you into one of our higher risk categories and really means you really need to get that checked out. You're looking at me like I know you're not going to, but I did want to stress that. Also, you say that you use recreational drugs every once in a while and that you also smoke. You say you only smoke 7 cigarettes a day. I'd advise you to go ahead and quit because that also increases, that's a modifiable risk factor that increases you, chances of you getting cancer. And I know you don't want that, or at least I hope you don't. So go ahead and stop smoking 7 cigarettes a day. You're almost there to
Smoke 3 then.
don't smoke
Gotta die
don't smoke any cigarettes.
All right.
And no recreational drug use. You say that you only do that occasionally anyways, you might as well stop. It's not good for your health. I know you work at McDonald's, but so you're surrounded by bad food choices. And you're a busy man, I understand that. But I need you to do more, be more proactive in your food choice and how you eat. Eat more vegetables, eat less red meat. Because both of those can contribute to not only prostate and cancer issues, but they also contribute to heart, cardiovascular issues and pulmonary issues. And as an African American male, you're at higher risk for some of these diseases anyways, like stroke and heart attack and cardiovascular diseases and diabetes. And I'd really appreciate it if you would take care of those issues now and address those non-modifiable risk factors. And see your doctor as soon as possible so you can get your prostate screening done.
McDonald's is free though.
I understand that, but still, you're working. Try. There are programs, and I can get you the information about healthy eating and waste. And there's healthy stuff at McDonald's too. They have the salads and milk and fruit. So there's other options instead of the hamburgers and the bacon and the salty fries. There are other
Chicken
options.
nuggets.
There are other options. There are other options. I appreciate you assisting me. I'd appreciate it if you would go and see your doctor about the things that we have talked about. Are there any questions? All of your systems were normal. There were no lymphoadenopathy. I didn't hear any adventitious breath sounds whenever I did your lung feels. I didn't hear any bruits when I checked any of your arteries. They were 3s, your pulses were 3s, your muscle strengths were 5, all of your cranial nerves were 1 through 12, which I named off earlier, were normal. There's nothing obviously wrong about you, but you need to make sure that you have a regular doctor's appointment and make sure that you follow up on those modifiable risk factors and get whatever you can under control. Like I said earlier, I appreciate your help and thank you,
Thank you.
Mr. Jackson.
Thank you. Ms. Lang.